Hello, everyone, and thanks so much for joining the latest episode in Grouper's webinar series, Why Social Connection Matters to Your Health. Today's webinar, The Wellness Benefits of Walking, specifically covers the many benefits of walking for older adults. My name is Ed Ryan. I'm with Grouper, where our mission is to encourage social connection and promote the benefits of group activity. And I'm very grateful to be here with our guest today, Dr. Theresa Soriano, Grouper's Chief Medical Officer. Before joining Grouper, Dr. Soriano had spent the majority of her medical career focused on the health and well-being of older adults. Dr. Soriano was a primary care provider for older adults in their homes for 20 years and saw firsthand how her patients benefited as much from her recommendations to walk or engage in activities they enjoyed, if not more than, the medications she would prescribe for blood pressure, diabetes, or joint pain. In her leadership roles, Dr. Soriano is most proud of the work she has done developing programs that meet both the physical and social needs of her patients so they can stay healthy and in the community. And as we begin with Dr. Soriano, I do want our community to know that this webinar is not intended to provide you with medical advice, and we encourage you to consult with your own provider before starting any new fitness or workout regimen. Okay, so let's get to it and start talking about the health benefits of walking. Dr. Soriano, thanks so much for joining. I'm excited to have you. And let's kick it off with this question for you. How does regular walking improve cardiovascular health and reduce the risk of chronic diseases like heart disease or diabetes?
Thank you so much for having me join you today, Ed. And hello, everyone. I'm excited to be here with you all today to provide some medical knowledge that will hopefully motivate you to keep building on your walking routine, start walking if you've been meaning to start, or talk to your healthcare provider about starting a walking regimen. So walking improves your cardiovascular or heart health and reduces the risk of heart disease and stroke in a couple of ways. First, walking strengthens the heart and lungs. The heart is a muscle, remember, so working your heart by walking increases your heart's ability to pump blood throughout the body. It also works your lungs. And as you walk, you probably feel yourself breathing a little bit more heavily. And as long as you're not out of breath, it's showing that your lungs are improving your blood circulation and oxygen levels to the rest of your body. Walking also lowers your blood pressure, especially if you're walking briskly. It will increase your heart rate, which improves your circulation, and that through the mechanisms of your heart and brain talking to each other actually lowers your blood pressure and can reduce your need for medications. You've probably heard of good cholesterol and bad cholesterol. Walking can increase the amount of protective cholesterol or HDL, which is good cholesterol, and reduce the levels of your low density cholesterol or LDL.
Great. There are so many heart health benefits to walking, Dr. Soriano. Can you please talk about a few more?
Sure. Um, People don't usually know how great walking can be to improve our overall health and function. And besides the heart health benefits, walking can also help you fight off infection by supporting your immune system, increasing blood flow, reducing stress, and stimulating your body's production of antibodies actually helps protect you from getting sick or sicker from things that might make you more sick. Um, Adults with joint pain or arthritis can actually use walking to improve their range of motion and mobility. And walking just 10 minutes a day or about an hour per week can do this for you, in addition to improving your balance and coordination, which can help prevent falls. And lastly, for women who are premenopausal, before menopause, walking can actually improve the strength of your bones, also called bone density, just by walking for about 30 minutes, 3 days a week. However, later in life, when you're postmenopausal, you can help keep your bones strong and slow the bone loss that happens with age by walking.
Wow. Thank you for that. And let's move on. What are the mental health benefits of walking, particularly in reducing stress, anxiety, and depression?
Most people who have taken a nice cleansing walk know that your head is clearer, your stress levels are lower after a nice walk. And that is because walking indeed does have very many mental health benefits. Like other forms of exercise, walking releases what's called endorphins and serotonin, which are known as feel good hormones. And these feel good hormones, when consistently in your body, actually can help improve your mood. And we have seen that walking even just 10 minutes a day, 10 minutes a day seems to be a magic number, can really improve your mood. In fact, a small study found that people with clinical depression who walked or did another form of exercise in addition to taking medication had better improvement in their symptoms than just taking medication alone.
Well,
In addition to that, walking can help reduce stress and anxiety by increasing the brain's ability to respond to stress and let go of negative emotions. Improving sleep happens when you walk. For some reason, that regulation of hormones helps the quality of your sleep improve. And that's often an issue for people who are older. In addition, walking increases your energy levels. So it helps keep you alert, awake, and some studies have even shown that it improves your cognition and your memory.
it's great. And how does walking help with weight management and metabolism compared to more intense forms of exercise?
Weight management and metabolism, especially in older adults, can be improved by walking, mainly because it's, again, we'll talk about this later, it is a low impact, easy to engage in activity that helps you burn calories. Walking burns calories pretty consistently, and the more you walk or the faster you go, the more calories you'll burn. Not many people know that if you're, say, a 150-pound person and you walk a mile in 20 minutes, which is a good pace, but not too fast, not too slow, you will burn about 80 to 100 calories. And if you do this once a day, or you do this for 20 minutes a day, uh, 30 minutes a day, 40 minutes a day, or, however you can build up to, that is many calories that you will have burned over the course of a day. In addition, when you walk, you are preventing muscle loss and in some cases, even building muscle. And we know that muscle burns a lot of calories in and of itself. So if you're able to keep your muscle mass by walking or doing other forms of exercise, it actually increases your metabolism and helps you burn calories even without walking. And as I mentioned, walking elevates your metabolism. And this is important because, especially if you choose to walk in the morning, it can jumpstart that metabolism, or
Mhm.
how well your body burns calories and keeps it elevated throughout the day. And that also helps with your energy level. And if you have something called diabetes or prediabetes, which is when you have high blood sugar and have trouble controlling it without medication, walking helps do this and can even lower your need for medication or insulin.
Wow, thank you. So a previous guest, a webinar guest of ours, Dr. David Sabger, who is the founder of Walk with a Doc, he referred to walking as the miracle drug. Can you explain, Dr. Soriano, how walking in a group or with a partner enhances overall health benefits and helps reduce feelings of loneliness?
Sure. Well, I have to agree with Dr. Sabgir that walking can indeed be called a miracle drug. As I mentioned before, any regular physical exercise like walking, especially when combined with social interactions, can improve negative moods, or ward off depression, and improve your physical health. And again, why walking is considered a miracle drug, or can be, is because it's a low impact activity that, as long as you have your doctor's approval and a supportive pair of shoes, you can do this wherever you are, at whatever pace suits you, and work from 10 minutes a day to 30 minutes a day. And more importantly, because it's not something that is a solitary activity, you can combine it with conversation, social interactions, and this really increases the connections you can have with people you care about while improving your health.
That's
Uh,
great.
Yeah. In fact, there is an article that came out from Harvard Medical School just last year that described in more detail that walking in a group or with even just one or two friends at a time can help you stay on track with your walking. And this was described to be due to two main concepts, which I like to call good peer pressure. And these make perfect common sense. The first concept is accountability. So, as a friend or with friends, you set expectations for each other and you don't want to let your friends down. So, you'll often do things you might not normally do to keep that promise. So, if you agree to walk with a friend on Tuesday at 10 a.m. and they're expecting you to meet them, then you're more likely to do it. So, that's one way that walking with friends or with a group increases accountability. The second is motivation. When you walk with others, you challenge and encourage each other more than you might do so just by yourself. Imagine that you're hitting a wall while walking. You've been walking for 2 weeks and you just don't want to do it today. However, again, other people are waiting for you and they're encouraging you to come. They're texting you, they're calling you. This makes you realize that you're wanted and people are
Hmm.
looking out for you and makes you motivated to keep on walking. So, those are two important concepts that help people stay on track with
Right.
walking with others.
It's great. And what would you recommend as an ideal walking routine for older adults, especially for maintaining both physical health and social well-being?
Well, Ed, this is a great question. And I think first and foremost, just as you mentioned to all of us in the beginning, you should always check in with your own doctor or healthcare
Mm.
provider to get their recommendations on how much walking you can do. I am firmly a believer in having people walk as much as they can to stay healthy. But since I'm not your doctor, it's important that you consult with your own. In general, though, it makes sense to start low and go slow. So starting at about 10 minutes a day, which might for some people be 2 to 3 blocks or a quarter of a mile, half a mile, 3 times a week can be a great start. Mondays, Wednesdays, and Fridays is a good example. As you go every week, try to work up a few minutes a day or another day per week to an ultimate goal of 30 minutes a day, 3 times a week at a pace that you consider brisk. And that is a great goal to work towards. You can make this goal with a partner or a friend, and again, helps keep you be more successful at meeting your goal because you're going to stay motivated and much more likely to hold each other accountable. Again, that good peer pressure. If you've already been active and you want to rev it up a notch, you can do this by increasing how often you go out. Maybe it's 4 times a week or even five, increasing your pace and go a little bit faster than you used to, increasing how far you go, or adding some hand or ankle weights, which also helps build muscle. Other things you can do to keep it from getting boring is inviting different friends to go with you, join different groups, or have a different person join you every day. Work your walk into your regular routines. You can try parking your car a couple of blocks away or getting off one or two stops before you need to from the bus or the train. If the distance is right, use that walk to go to the post office and run an errand or drop by a friend's house instead of driving. Change your walking routine. Have a destination or a reward or a place to meet up at the end for lunch or coffee. Listening to music if your friend isn't able to make it that day. Try something indoors as the weather gets colder or rainy or too hot, depending on what part of the country you're in. Many malls or indoor buildings often have walking routes and even scheduled group activities to do so.
It's great. And right before we recorded, Dr. Soriano, you and I talked about some research you came across um, referencing walking alone versus walking with others. Can you please tell us about that?
Sure. Well, not to repeat myself too much, but what we just talked about in the last few minutes about accountability and motivation and how important that is to stick with your walking routine and how much friends and other folks in a group help you stick with things. That is all based on research that has been done over the last several years, and it's getting more popular now as people see the great effects of walking and how well people stick with it when they're including this with social interaction.
Mhm.
So a couple of studies I can talk about is one done here in the US that was done with older adults, given a walking app on their smartphones that tracked their steps and their overall progress. Half of the people were assigned to walk with a group. They could make text and make plans and encourage each other to go. The other half only had the walking app without the social function. So they couldn't see each other, or they'd have to go out of their way to make plans with each other. It was not in the app. A month later, the group of people who were able to communicate with and meet each other walked more often and walked for further distances than the group who were not connected with others. So that's one example of why the social connection is so important to more consistent walking.
Wow.
And a last study that I'll just mention, but there are many others that support this, was done in Taiwan that showed pretty similar results. This was done with a group of older men and also given a fitness watch that tracked their activity and heart rate. Half of them were split up into groups that walked together on a regular basis in assigned groups and had a group leader. The second group was encouraged to walk independently using the smartwatch. And the third group was told to do whatever they normally do, and they were given the same watch. And just like in the first study I mentioned, it was the first group that had people grouped together with a team leader, walking more often, burning more calories during these walks, and walked more consistently over time than even the group that were encouraged to walk on their own. And obviously, more than the group that was just given the watch with no instructions. So these two studies are very important in showing how walking, when you combine it with walking with others, can really help both your physical, social health, and your ability to keep sticking with your routine.
Mm, that's great. Well, thank you so much for taking the time to join us today, Dr. Soriano. These insights on walking and walking wellness and health were incredibly valuable, and I'm ready to go out and find a friend and take a walk outside right now.
All
So,
right. I will see you out there, Ed.
all right, let's do it. You're in New York. I'm in Boston. We'll meet in Connecticut,
Yes,
halfway.
perfect.
Um,
I'll
get
get
a good pair of
started.
shoes. Well, thank you, and thanks to everyone who watched the wellness benefits of walking, and we'll see you next time.
Thank you.